Got your spine?
Yep.
So on this clinical insight, we thought we would ask our very own Dr. Kyle what actually happens or you're trying to accomplish with spinal manipulation, just kind of in the realm of chiropractic, which we could get into a bunch of different offshoots, but just the basics of it. You know, what's the pop that we hear, like what's actually occurring?
Sure. So the pop that we hear is basically within each joint. So a joint is where two bones come together, and that joint is surrounded by a capsule. So there's fluid inside the joint to kind of help lubricate it, help it move. And basically, when you get that joint to tension or get it past that point of tension, you hear that pop sound, you know, like if you crack your knuckles or something. There's a buildup of gas within the capsule, and it's either a release of gas or a buildup of gas. And that's what causes the noise that you hear. And that's why you can, you know, crack your knuckle and you hear that pop, and then you try to do it again. You can't do it for about another 15 minutes or so until that gas, you know, builds back up again, and then you can, you know, get the pop again.
So it's not arthritis?
No, that is false.
That is a false statement.
That is false. That has not been proven unless it's yet to be determined, but yeah, it will not give you arthritis.
So I'm gonna put you on the spot with this one. So like, why does the gas come back? Like, so like you just said, like when I crack there, like why does that eventually come back necessarily?
No idea.
Oh,
I don't know why. If it's just because of motion, like moving it, and if it just like ultimately equalizes out.
I would wonder with
I'm
some
sure
things
somebody
like,
knows, but I don't.
could it be postural things, like if you're not in alignment, even though it still kind of comes back no matter what, you know, could it be, because we all try and be clean eaters and things as much as we can, is it that?
I don't think it's necessarily a good or bad thing. I think
Okay.
it just is, you know, like that is part of the joint and the capsule itself. You know, for someone, you could adjust their mid or upper thoracic region, and you could do that probably multiple times a day on people. Like you said, due to postural type things, they need it. However, what you're looking for in the adjustment isn't the crack or the pop.
Right, so that was going to be my next
either.
question.
Yeah, we're looking for other things than just to get the noise.
Just to make the noise.
Yeah, it adds to it, and it is nice to hear, but yeah, that's not all we need to look
Gotcha. So what are we actually looking for?
So what we look for when we check to assess a joint and feel, I often tell people, and I'm stealing this from the doctors at Motion Palpation Institute, but you feel for a block of wood versus a block of cheese. So when I kind of palpate and feel that joint motion, you want to feel just a slight amount of give to it, and that would be like a block of hard cheese, as opposed to, you know, like a block of wood where it's just very firm and it doesn't have that little end feel there. So if it's got that motion, joints are meant to move, and that is a good thing. That is what we're looking for. So if we get that block of wood, that joint is restricted, and that's what the adjustment is looking to do, is just kind of restore that motion to the joint. So if that joint, you know, should be moving and it gets fixated and stuck, that adjustment will just take it to tension, and then that force kind of frees it up and allows motion again in the joint. So there's other components to the you know, the joints as well. It's not just about bones. It's not as simple as that. You know, there's a neurological component. So there's nerves, you know, obviously the spinal nerves coming out, but then there's other nerves associated with that joint that are smaller. So you're going to have a nervous system component. There's also, you know, muscles and tendons and ligaments and everything attaching. So if that gets restricted, not only is it going to affect the nervous system, and also you can get, you know, a muscle spasm or something where it's tight. You can also get where it's inhibited. So it could be various factors there. What else? We could have inflammation associated with that, just like some edema, maybe some heat. Sometimes you can just feel a little bit of heat there. You can also, like, that inflammation can cause like inflammatory chemicals, and that can cause some pain with it.
Right.
And then eventually you talk about arthritis, then, you know, if it's not taken care of years down the road,
The buildup of
that,
all of that.
can lead to, you know, some of the pathologies and everything.
Absolutely.
So, yeah, in a nutshell, that's simplified.
There you go. So the other one then, like, I don't know if it's is it bad or how bad is it if I like self-adjust by, you know, going and cranking or throwing a leg over and seeing what goes, or sitting in a chair? Like, what are your thoughts on that?
So my thoughts are, in the neck, I'd say no, for sure.
Okay.
Just because typically you look at a person and, you know, if they look up or extend their neck, they've got this crease across kind of the mid cervical region. Usually that area has too much motion as it is, and that's where you get that. And typically, like, the upper neck or the upper back is going to be inhibited, so it doesn't have quite as much motion. So it's kind of a balance. So because this upper back isn't moving in a person, then their body's good at compensating and adapting to that. So then we get excessive motion in the mid-cervical region. And actually, a lot of times those areas of degeneration that you see in the neck are kind of in that mid-cervical region, and coincidentally areas that have hypermobility. So when someone is adjusting their own neck, they can get that crack and that noise, and there's a little bit of endorphin release, so that feel-good chemical, but that's why it feels good for maybe 10-15 minutes, and then it comes back.
So they have to do it again.
It's because usually they get the crack in those areas that are already hypermobile, that have too much motion already. So when we adjust, we try to adjust those areas that don't have as much motion, that need it, and that way it kind of allows the areas that are moving too much to not have to, you know, take up the brunt of all that motion. So yeah, that's in the neck, what I would say. For the mid back, I think it's great because typically people are, you know, so hunched, everything, text messaging, driving computers, everything here anyways. If you can get on a foam roller and create some extension and some motion in there,
that's double tennis ball. Thing.
Yeah, I got one
nice,
right here actually. One of these guys.
Let your spine sit right in there, so it's nice and comfortable.
If you can handle it, it's intense at first if it's a pretty tender area.
Yeah,
but
tennis balls before this one. This thing's got some serious.
But it's good if you can get some cavitations in through there. That's awesome. I think it's great if you can do those on your own. And I'm a big believer in foam rolling. People, you know, send those home and it becomes their best friend.
Right.
Even if you can't get the pops and cracks, it's good to just kind of loosen things up and get a little bit of motion in through there. And then the leg over thing, typically it's not too bad. If you can isolate it to maybe like an SI, that's, as opposed
for me, that's typically where mine's at.
Right, as opposed to maybe sometimes the lumbars, the mid-lumbar region is like the mid-cervicals where you have an excessive amount of motion, so then it's kind of reinforcing that. So ideally you want it to be specific. I don't, you know, I'll recommend a crossover stretch or something. If you can get a pop with it, whatever, that's fine. But the big no-no for me that I tell people is, you know, the self-adjusters of the neck. I know it's a hard habit to break, but I recommend it.
Guilty of that one.
And I've tried to be specific and get my own neck if I need it, you know, like very up high and stuff, and I haven't figured that one out yet. And I don't know anybody that has.
I would say, because you can't necessarily get it to go on yourself, you almost have to get just your own muscle using it, but that could also be hard because it's now active.
Right, yeah, exactly.
Instead of passive when you bring people to attention. Makes sense? Anything else on the basics of adjusting?
I think that's the down and dirty, yeah. Alright. Leave it to a professional, but yeah, get after the foam roller.
There you go. That's this clinical insight.